Good afternoon, everybody, or good morning, depending on when you're watching this. First and foremost, thank you to the CIINDE for inviting me to this year's conference to speak to you about medical thermography. And thank you to each one of you who are attending the conference this year and watching as well. So my name is Catherine Spear, and I am the Certified Clinical Thermography Manager and Director of Thermography Clinic, New Brunswick. My location is in Salisbury, my standalone clinic with 11 clinics across the Atlantic provinces. I'm in all of the 4 provinces, so New Brunswick, PEI, Newfoundland, and Nova Scotia. And I'm very pleased to be here today to talk to you a little bit about thermography. It's new to Atlantic Canada, but certainly not new to the industry or across the world. So we'll get a little bit into that today and what lies beneath the surface and how thermography can help. So what is medical thermography? Medical thermography is non-invasive. It's no touch, no radiation risk assessment tool of the physiological body. So oftentimes when we talk about tools, there's diagnostic testing, obviously, at the hospitals. And then, of course, we've got thermography that does the physiological aspects of the body. And infrared imaging measures the infrared radiation, which is your heat, which is constantly emanating from or away from the surface of our human skin. And as you all know, skin as an organ breathes, exchanges gas with the environment, cools us as well as keeps us warm by letting heat out or keeping it in. This automatic regulation is done without conscious thought and is controlled by our autonomic nervous system via the sympathetic body. Now, when we talk about heat in the body, right, where there's heat, there's inflammation. And where there's inflammation, that is a precursor to disease. So this is why thermography is very interesting in what we can see and how we can see what's happening inside the body to alert us on what's going on, what we can do differently, what we can do to help support our bodies. So very much my take on this and how I work and hopefully I see you before it gets to disease stage is really helping our clients to understand what is going on in the body and then what they can do to help course correct that before the body hits disease stage. And so today I'll be taking you through that. So who is our Medical Advisory Board and Interpretation Center? Obviously, I do not do the readings. I am not a doctor myself. I do the scans, so I run the clinics and responsible for the clinics. They're my own business, and I am the scanner, basically. So who does the readings and who is our board of directors that keeps all of this wonderful technology going and all of our additional training going? We have Alexander Mostovoy. He was a former homeopathic doctor, and he's also a board certified clinical thermographer as well. And he's also our interpretation partner. There's a little bit of information here about him on that. He's definitely well known across the globe for what he does and for the many trainings that he does for doctors on medical thermography and how it can be used in practice. Then we've also got Dr. Alvin Peddle, who is pioneer Canadian gynecologist. He has delivered over 10,000 babies. He's also the authority on natural hormone and integrative medical therapies for women. He lectures to doctors, nurses, and the public on the integrative management of premenstrual syndrome and menopause. He is also a preeminent specialist in natural hormone replacement therapy, and he's also out of Toronto. Dr. Robert Kane, he brings over a decade of experience in the field of thermography. He had acquired his certifications and training through the International Thermographic Society. He's also achieved diplomat level certification through the American Board. And he's also been recognized as a fellow by the International Association of Clinical Thermography for contributions to the field of thermal imaging. And Dr. Kane frequently lectures to physicians and laypersons on the role of thermal imaging in the clinical practice, while also serving on the board. And if you've ever heard Dr. Kane speak, he's phenomenal. If not, you can Google it. He's got some great YouTube interviews out there. But his personal mission is in transforming women's fears from breast cancer into empowerment towards prevention. Then we also have Dr. Deacole. He is, after 27 years in his practice, he served as the chief GYN surgery in the Long Island Surgical Center. He also promotes prevention and optimization of the hormones that control and regulate the human body and its health. He also has his focused efforts in helping patients achieve better health using functional medicine and bioidentical hormones, nutrition counseling, and nutritional supplementation. That's a little bit about our medical advisory board. Now, scientific studies on breast thermography. So breast thermography has been researched for over 30 years and has over 800 peer-reviewed breast thermography studies that currently exist in the index medius. So in this database, there's well over 250,000 women that have also been included as study participants. And some of these studies have followed patients for up to 12 years. And with these studies, breast thermography has an average sensitivity and specificity of 90%. So for any of you watching and you want to get your hands on some of these peer-reviewed studies, please feel free to reach out to me at the end of this presentation. We'll go ahead and share my contact information, and I'll be happy to share that with you. There's also a link on my website to a couple hundred of the studies, and that's at thermographyclinicnb.com, that you can also go ahead and take a look at. So I want to jump right into the use of thermography, and we're going to start with the breast thermography. I'm very passionate about that. I've also had my own experience with thermography when I had breast health issues and couldn't figure out what was going on with my breast. And thankfully, I always say thermography found me versus the other way around, which is where my passion grew from being able to help my own health and turn that around. Anyways, that's a whole different story for another day. But, you know, is to put it all in perspective, right? I mean, I know we hear a lot about, you know, breast cancer awareness, and, you know, most of us are very familiar with that. But I want to impart some information with you that was just really shocking as I started putting together, you know, my own numbers a while back. And basically, you know, if 3 jumbo jets carrying 572 people, so that's 1,717 people across those 3 jets, crashed every single day of the year. Now that's 3 jumbo jets, 572 people on all those 3 jumbo jets each. Sorry, if they crashed every single day of the year, would you still fly? I can tell you my answer would be a resounding no. Those odds are just, you know, way too out there for me. And I certainly would definitely lose, you know, credibility into the aviation world, right? That's a lot of people, 1,717 every day on plane crashes. Yet, that is the exact number of women that die every single day of breast cancer. Let me let that sink in for a minute. Again, that's 1,717 people that die every single day. And yet we're still in the same situation as we were 50 years ago. It's much worse, actually. You know, listening to Dr. Alvin Peddle talk, you know, years ago, I think it was about 25, 30 years ago, it was, you know, 1 in every 50 women would end up with breast cancer. Here we are in, you know, 2021, and it's 1 in every 8 women will end up with breast cancer. Those statistics we cannot live with. Those statistics are numbers, but they're not just numbers, they're people. And we've got to be doing something different. Dr. Raza talks in her book about how, you know, 50 years from now, historians will look at the way that we've treated cancer and will also think that it was, you know, barbaric, right? You know, 50 years ago, we were still doing the same types of treatments, et cetera. And I'm not saying that that those are, you know, not legitimate. Obviously they are, and I'm not a doctor, but we've got to be doing something different in addition to what we're already doing, because the numbers are continuing to get worse. They're not getting better. So here's the breast cancer statistics from 2019. And again, this is some additional information that really helps you put things in perspective. So 2 million women worldwide this year will be diagnosed with breast cancer. Almost 296,000 of those 2 million are going to be right here in the US and Canada. And 627,000 of those women will die this year. Those aren't statistics that we should be taking lightly. And they're not numbers. They are us. They are our daughters. They are our sisters. They are our aunts, our grandmothers, our mothers, our nieces. They're our friends. They're not numbers. And every single one of us, I'm sure, has been touched by somebody that we know with breast cancer or cancer in general. So, why? So 3 problems, right? So from a current paradigm perspective, when I look across the board, and like I said, when I had some breast health issues myself, there's no prevention. We've got screening, but we don't have risk assessment. So how do you have prevention if you kind of don't know where you're at, other than if you have a history of it in your family, right? So think about that. There's lots and lots of breast cancer awareness, right? So but it's all about the breast cancer itself, but there's not a lot of education around prevention of that. And so again, we've got the screening versus, risk assessment. And what does that mean, right? So we focus a lot on the cure, which we absolutely have to. We focus on the cure, but again, that scale is not equal from a prevention perspective. So, I have a 19-year-old daughter, and knowing what I know now over the last couple of years, with thermography, I'm able to start helping her understand a little bit better how to, ensure that she does the steps that she can to have better breast health. But imagine if I had that information when she was just a baby, even for myself, right? So risk assessment versus screening, what does that mean? So risk assessment is a functional test, which is what thermography is, right? And it's a risk assessment on what will happen based on the current imaging, based on the current breast health. If you did nothing else, it's the functional testing. Structural testing is that it's already happened, right? So that's our structural testing that we have today, which is through the our mammogram, our ultrasound, and our MRI. And, thankfully we do have those tools, because there's no perfect tool that's out there. However, structural testing, once they find it, that means you've already have it. And that's not early detection. So the benefits of thermography, again, non-invasive, no radiation, no contact, detects inflammation. It's physiological, and it's the functional screening aspect. Now, hear me loud and clear when I say this. Thermography does not replace mammography or ultrasound. Mammography and ultrasound are structural tests. Thermography is your functional and your physiological test. So when combined, and I've got some stats here for you a little bit later, but when combined, that is a woman's best defense. And yes, there are other uses for thermography, which we'll get to through this presentation today. But again, it does not replace, but allows you as a woman to see what is going on in your breast tissue long before a lump appears. Hopefully we see you long before that. And there's other things, a mammogram wasn't designed to be able to tell you if you've got hormonal influence that's impacting your breast tissue, right? So there's other things that can be happening in your breast tissue that not necessarily are cancerous at the time, but can lead to that. And as we all know, thermography, mammography, or ultrasound cannot detect cancer. The only way that you can detect cancer is through biopsy. So I want to make sure that that's very clear. I know some people are, get confused on that. And I know I'm talking to a lot of nurses here today too, so you are very much aware of that. But for the general public, sometimes some of my clients don't understand that. So again, it's, structural testing and or thermography cannot detect breast cancer. The only way that you can detect that is through your biopsy. But in order to get to the biopsy, you have to have some of these structural testing done. In addition, you can add thermography. So what does breast thermography look like? Because I could sit here and talk about thermography all day long and bore you to tears, but I want to be able to show you some case studies. I want to show you some of my real live client examples of what does breast thermography look like? What are some of the things that we see? And we're also going to get into, the rest of the body, because we also offer full body, lower body, upper body, and dental cranial thyroid testing as well too. And so that you can see what are some of those other aspects that you can find out what's happening in your body to really help your body and helping the landscape become healthier. So again, Thermography, non-invasive, FDA approved. It's an adjunctive screening tool. It's based on the scientific premise that before the growth of abnormal cells can occur, an increased blood supply must be circulated to the growth area. It measures the heat generated by the microcirculation of blood in the breast during the process. Structural tests such as mammograms and ultrasound rely on finding physical lesions, which is your anatomy, while breast thermography detects asymmetrical blood vessel circulation, which is your physiology within the breast. Okay, so you can see here, there's some normal symmetry of healthy breast. You've got suspicious vascular activity happening here, and that's pretty clear. Inflammatory breast disease, again, there is no testing tool out there for inflammatory breast disease, but certainly with thermography, that is something that you can use to monitor that. You've got male breast cancer, and yes, it does happen to men as well, certainly not the magnitude it does in women, but unfortunately for men, by the time that we find that they have breast cancer, most times it's already spread to the organs. And here we've got some DCIS in the left breast. So dental pathology in breast cancer. Here's another example. You can see here, so dental pathology, I'm going to back up just a second because dental pathology, if there's inflammation here in your dental pathology, it's leaking down, and it's leaking down into the submandibular glands, it's leaking down into your lymphatic system, it's leaking down into your breast tissue, your thyroid. So look at this image here of this poor lady. She had dental pathology issues, and quite significant. As you can see, it was coming all the way down into her neck. And again, can you imagine what that's doing to her thyroid as well too? But here you go, it comes all the way down and into the breast. And unfortunately, yes, this client was diagnosed with breast cancer. Nipple temperature and dense breast tissue. So this client was diagnosed with a 2.4 centimeter tumor behind the right nipple after her breast thermography screening detected an area of concern with elevated heat. And again, that's increased blood flow. She did have, several mammograms, but it was missed due to having dense breast, and she's in her 40s. But you can see it right here. So part of one of the items that we also test when we do your risk assessment on your breast thermography is we also test the nipple temperature and the periareolar region, because those two areas are the coldest spots on the breast tissue, and heat will always track itself to the cold. So as an example of that, if you opened up a window and it's cold outside and you lit a match, that flame off the match is always going to lean towards the cold. Or if you lit a fire, right? You always probably heard your dad or your grandfather saying, open the draft. You open the draft because the cold air has to come down so that the flames will shoot up, right? Again, heat going towards the cold. So we also test that area because that area is very, very sensitive. And we know based on some of our some of the science behind thermography, that if this temperature is above 1 degree at the nipple and 1.5 degree above the periareolar area, that there is a concern there that needs to be identified and addressed. Okay. Another client with inductal carcinoma with mastitis into the upper abdomen. And you can see here on the breast, and then it spread, unfortunately, down here into the upper abdomen. And this was clinically verified as well. And again, thermography couldn't identify that it was carcinoma. Remember that. But this area of concern, obviously, the client was alerted that this was a large area of concern and needed clinical assessment. And so it was later identified that it was inductal carcinoma, and it had spread into the upper abdomen as well. Cell phones and breast tissue. Oh, this is such an important topic for me. So this client, she was a client of mine, ex-RCMP officer, came to have her breast thermography done because she was having pains and an uncomfortable feeling in this area of her breast consistently. And she didn't understand why that this was happening, but you can see that there is definitely an increase in inflammation in this area. So being an RCMP officer, it was very interesting, and certainly the light bulb went off for her because her vest, so their protective vest that they wear, the cell phone pocket where they carry the cell phone is right here in the vest. And so the cell phone was always up against the skin. And so I tell women all the time, and I have seen this in my past life in the corporate business world, where women would always tuck their cell phones into their bras. Please do not do that. This, again, even though it's, I know it's small, and people say, oh, it's low level radiation. It doesn't matter. Your breast tissue is so sensitive, and this low level radiation is going up against your skin and your cells. I know I don't have to be a doctor to tell you that, right? Your cells respond to that. And so you can see that very clearly here in this scan, where that cell phone was laying up against her skin all the time. And then she had an increase in inflammation. So please do not put your cell phones anywhere near your breast. I did have a client that went through cancer of her abdomen, and she was telling me that her oncologist shared with her that a cell phone should never be placed anywhere against the body from the private area up. So just some additional information for you there. Hormonal influence on breast tissue. Again, I talked about that a little bit earlier, right? So again, as a woman, how do you know if your hormone levels in your body are impacting your breast tissue? That does not show up on a mammogram or an ultrasound. And so this client here, as you can see, she's got quite a bit of hormonal influence happening, very red and angry over here and down along the side, and as well as here as well too. And then you can also see that in this area. So as we all know that there is, breast cancer that is created and started by hormones, right? Hormone influence. So again, women, it's very important for you to understand if you've got hormonal influence happening in your breast tissue. You can course correct that. And that is something that you can support your breast tissue with before it turns into something else. This client had clinically confirmed breast cancer following her thermography scan. And you can see that right here. Treatment monitoring. So we also use thermography for treatment monitoring of breast cancer. So this individual had pretty severe hormonal influence into the breast tissue and into the talus pens area, and all the way you can even see it even up, going up to her neck. She had a follow-up scan, and after 6 months of homeopathic treatment, you can see that her breast tissue has turned back into normal. However, had she not understood that there was hormonal influencing here happening in her breast tissue, this would have gone on and then, may have progressed to something else. Another client of mine, she is going through, she went through lumpectomy, chemotherapy, and radiation. And so she wanted to be able to use thermography in addition to working with her oncologist to see how things were progressing after her treatment. So this was 3 months after she finished her radiation. And then this is 9 months after that had first started. So you can see that it's progressing nicely. We also took the temperature of her nipple and perioral region. And from the first time that she had originally came to see me to this last time, she was tracking downwards each time. So which is where she was, progressing nicely, which is where she was supposed to be. All right, so that's a little bit about breast thermography. Now I've got a few other scans here because I want to show you that we also use thermography for other parts of the body as well too. So dental cranial thyroid examples. So this lady, she's one of my clients. She has a thyroid issue, so hypothyroid. So with thermography, we can pick up on whether your thyroid is warm or it's cold. The doctors can also see if there's enough warming there that may be causing nodules on the thyroid. And this lady came to see me because she was like myself a few years ago as well. She had all the symptoms of hypothyroidism, but yet her blood work came back within normal range. But because your blood work comes back with a normal range does not mean that your thyroid is not tracking in the wrong direction, right? Especially where you've got some of the symptoms. So she came to see me to see if her thyroid would show up with any, hypothyroidism, because again, she had many of the symptoms. And of course, as you can see here, it did. So, what do we do in a case like that, right? Because again, we know that the doctors can't help us until we're in disease stage with our thyroid, but there's a lot of naturopathic and homeopathic integrative medicines that can also help to support your thyroid before it gets to disease stage. Again, remember, detection of any disease is important, but prevention is the key. This client, gosh, this poor guy, he was just in a lot of pain and he just couldn't seem to get any answers. So he came and he had significant hypothermia in the right temporal region, his right ocular and right buccal region, which was suggestive of neurological connection when our doctors did the readings of the scans. Later on, once he was able to take these scans to his doctor, they clinically confirmed that it was permanent nerve damage. And as you can see, there's lots of inflammation there that's happening for him. He was in a few accidents before, and he also was into boxing. So left him with some pretty severe nerve damage there. But you can also see that his dental pathology issues, he's got a few happening there, and he was aware that he did, and he had been going to the dentist, but you can see that it is leaking down into his neck and down into his lymphatic system. So you can also see he's got some lymphatic congestion happening there as well too, along with his cervical muscles are very hypertonic. Sinus, dental, and lymphatics. This client, another one of mine, definitely increased hypothermia in both his maxillary sinus regions, extending into his nasolabial folds, which is suggestive of sinus drainage issues. He's also got hypothermia in the lower oral region. So he's got some dental pathology issues there, and he's got significant hyperthermia in the submandibular region, which is also suggestive of lymphatic drainage issues. This was a very interesting one. Not my client, but last year or not last year, it was supposed to be November, just gone by, we were on a training call, and we were very blessed to have this police officer on with us, because this is how they're also using thermography in South Carolina at one of their divisions, and helping women with domestic violence, strangulation more specifically. So you can see here, when they took a picture of her neck, it didn't show that there was bruising there. But when you take thermography and they applied it directly following this picture, you can see the person's hand directly on her throat. So, the possibilities that you can use thermography for are great. Upper and lower body examples. So, my question is, do you know your body's level of inflammation? I can tell you a few years back, I didn't, and I was quite shocked. And I thought that I was, being pretty good, looking after myself, but, high stress corporate job and a few other things that in my life that I needed to change up, certainly helped. But this gentleman in particular, you can see where the areas of red and white, they're showing backed up inflammatory product, right? That's suggestive of. So the two main channels, lymphatic system on the right and the left, are blocked off, not allowing the head and the neck to drain. But can you imagine? So regardless of what it's suggesting, can you imagine this amount of inflammation in your body and how this person would respond, to our recent, pandemic, right? Because your immune system is so important. And if you have a weakened immune system because you've got large levels of inflammation, your body can't fight very well. Oral infections and your organs. So another individual, you can see here dental pathology issues. Again, that inflammation is leaking all the way down, and it's all tracked itself all the way down and into the lymphatic system on the right side, and it accumulated over the liver region. And you can see that right here. And just so that everyone knows, this individual also had clinical correlation completed as well too. So you can see that. I mean, it's pretty telling, right? Vagus nerve and forward head posture. This was one of my clients, a 20-year-old, had not been feeling well at all, and went and had some testing done. They thought that it was anxiety because he was having a lot of, neck issues, so pain, tension in the neck, but he was also having a lot of stomach issues. Sickness in the stomach, felt like eating, but would start to eat and not want to eat. He'd lost 20 pounds, just a whole host of issues. So he came for a scan, and then in consultation with another doctor and an osteopath that did an assessment, it was determined that he had forward head posture. So that's where your head goes, you know, up and off of your neck. And you can see that here, that his head was pushed forward. Now, he obviously has had this for quite some time. He's had very bad posture over the years. But what happened that triggered this issue in August was that he was at the gym and he was working out. He was doing core that day, had a big plate, a weighted plate on his stomach. Head was off the floor. And so he was doing, you know, crunches. And when he was doing the crunches, because his forward head posture has been getting so bad, and all that pressure that was there, and then of course with the weights and he's doing crunches, he ended up pinching his vagus nerve. And when he pinched the vagus nerve, that is what caused then him to have a little bit of numbness in his left arm, tingling. He felt like he lost a little bit of his vision. He got very sick and he vomited that day, but then had never been the same after that incident. And come to find out, again, this is what it was. And now he's going through obviously treatments with the osteopath and with another doctor, and he's starting to get better. So again, another way that you can use thermography to determine what's happening, especially in those cases where it's really difficult to try to figure out something that is going on, or it's something that's been going on for quite some time. We also find that in a couple of cases, I've helped a few people that had workplace injuries, because again, everything structurally came back fine, but they were still in severe pain. But it's soft tissue damage, right? So when you have a lot of soft tissue inflammation, that typically doesn't show up on the diagnostic testing, but it certainly does on thermography. So again, you can help people to see what's happening in the body and then prescribe for them, you know, the right level of care. And again, I don't do that, but certainly I can give them options, and, you know, going back to their own family physicians with these scans to show what's happening in the body certainly helps as well. This was not a client of mine, but of somebody else's, but this lady ended up with melanoma through thermal imaging. Obviously it was diagnosed after the thermal imaging, but you can see here what we picked up on the images. And to the naked eye, it doesn't show anything, right? But then once we did the thermography scan, you can see right here. Intestinal dysfunction, right? So this scan shows that there's hypothermia in the upper abdominal region, which is suggestive of intestinal dysfunction. And again, you know, then people can take this and have further diagnostic testing done, because again, there's definitely something going on in the upper abdomen here of this individual. Liver dysfunction, again, we reviewed that a minute ago with the gentleman with the dental pathology, but this person had symptoms, or didn't have symptoms, came for a scan. It had some on and off, not feeling very well, but, you know, didn't really pay too much attention to it. But in this case, you can see that she's got inflammation in the upper right quadrant over the liver. Body misalignment. Oh, how many people are suffering from body misalignment and don't even realize that they are? You know, oftentimes they'll go to the doctor because they've got, you know, aches and pains in different aspects of their body. The doctors do, you know, their intake and their assessment, and, you know, they can't find anything, but oftentimes it's body misalignment. And I see so many clients with that. But you can see that the posture of this client's hip on leveling is doing to her venous return, right? So, you know, lack of blood flow, the blood is pooling, right? And her inflammation in the right foot and anterior compartment. So most people honestly don't even realize the impact that when your body is out of alignment, what that does to the overall rest of your body. And then of course, I don't have to tell you that, you know, on certain sides where you are in pain, then your other side of the body is also overcompensating, which then also causes additional issues and additional stress and additional inflammation into your body. You know, there's chiropractors, there's osteopaths. They do wonderful work in helping you to realign your body. So if you don't have one, I suggest you get one. Neuromuscular treatments and thermography. So this, again, this was not my client, but it was of somebody else's, which I found was very fascinating. So This full body thermography shows the improvements that were made by a chiropractic patient. The physician treated her neuromuscular complaints and took the follow-up scans at 12 visits, right? So she had a total of 36 treatments. But you can see, you know, this side of her body is lopsided. Look at the inflammation. Look at it was just incredible what was going on there. And then look after 12 treatments, right? Then 24, then the 36. And look at how much straighter, you know, that person is here. Look at that, and the inflammation. So pretty incredible when you can combine the two to really track treatment and how people are progressing as well. Severe lower leg pain. This was one of my clients. She came to see me after 3 weeks of having severe leg pain. They couldn't figure out what was going on. She had just got up from her desk and walked over to her printer and took a severe pain in her leg. It progressively got worse. She was hobbling. She could barely stand. So she came for a lower body scan so we could see what was happening in the leg. And you can see that she's got high levels of inflammation there. However, the problem with her leg, and this was not diagnosed by me, but this was through the osteopath, it ended up being her back. So as you can see here, look at her neck and then her back and then her lower back. And so the osteopath shared with me that it was her lower back issue and neck that was causing this issue to show up in her leg. And so after one treatment, my client called me and she was ecstatic because her leg pain was gone. And she went for a second follow-up, I think it was 3 months after, just to make sure that everything was in alignment and she was in good shape. So again, her leg pain has not returned. So again, understanding what's happening in the body, and sometimes where there is pain showing up does not mean maybe that's where the root cause is. It could be something else that's more priority, but this is an offshoot of that. So from a thermography perspective, right? A diagnostic aid, you know, helping the medical community to identify something else that may be happening. Certainly less stress on our, you know, medical our medical teams today, and less stress maybe on the you know, MRIs and ultrasounds and things of that nature that can be used in conjunction with that, right? To be able to identify maybe what else needs to be done for this client in order to figure out what's going on with them. Thermography is an early warning system. It's a risk assessment, it's treatment monitoring, and it's prognostic indicator. So problem to solution, we reviewed this earlier on in the presentation about the paradigm, right? So again, how nice, you know, it's just fresh eyes, right? And it's a fresh way of looking at things and changing that paradigm to be more in the, let's be in prevention through risk assessments. We can be more preventative than with our own health and take our own health, you know, very serious and course correct it before it gets to disease stage. Nobody wants to be in disease stage. There's not one person that I know that could say, yes, I want to be in disease stage. Nobody wants to be there. But it's about prevention. And oftentimes, you know, we think we're doing some of the right things for our body, and maybe it's not enough, or maybe a different part of our body needs additional help. And so through thermography, you can see where there's inflammation in the body, and then you can make additional decisions from there and support your body in that way to bring it back to, you know, a healthier state. So as we get ready to close this up, right, my question for you is this: do you know how well your body is performing? Do you know what it is that your body's trying to fight for you? Because our bodies are so incredible at healing, but we have to give it the right playing field to be able to do something, to do that for them. So staying on the side of prevention versus disease management, you know, book your thermography scans. There's clinics all across Canada that have, you know, they're supported underneath the medical team and the interpretation center that I was talking to you about earlier on in this presentation. So we've got clinics in Alberta, British Columbia, Ontario, Quebec, New Brunswick, which is my clinic, which then is underneath me. So I've got mobile clinics, or I want to call them satellite clinics, because every time I say mobile, people think I have a big van, but I don't. I actually have partnered with different healthcare professionals. And so I rent space in their clinics and bring these satellite clinics to you. So I have clinics in Nova Scotia, PEI, and Newfoundland, and of course, all across New Brunswick. So there's 11 locations to serve you. And if I am not in your area across the Atlantic provinces and you would like for me to be there helping your clients and or your community, please feel free to reach out to me. I'm always expanding. This is such important technology that I want to make sure that everybody in Atlantic Canada has an opportunity to use it. So please feel free to reach out to me. So thermography, making the invisible visible. And here's my contact information. It's thermographyclinicnb.com. My phone number is 999-6302 with area code 506. And I can be found on Facebook and Instagram as well. I wish I had time today for some interactive questions, but I will leave you with this. Please feel free to reach out to me on my social media platform. Give me a call. You can also text this number that's here on the screen. Send me an email. I am happy to answer your questions or to find out the answer if I don't have the answer. But certainly, very passionate about helping people become more preventative in their healthcare needs. So with that, thank you all very much for joining me here today. I do hope that this was beneficial for you, and I look forward to hearing from you. Take care, and thank you again to the CIINDE for inviting me here today.